Alright, so we're going to pick up with acute pancreatitis starting on page 1218. Acute pancreatitis is when there is inflammation of the pancreas. Okay, autodigestion occurs, and that is kind of what makes the inflammation happen. Now, symptoms can be mild, up to necrotizing hemorrhagic pancreatitis, or NHP. With necrotizing hemorrhagic pancreatitis, we see bleeding pancreatic tissue, and we see tissue death. Okay. Now, it's important to remember that the pancreas has two functions. It has an exocrine and an endocrine, and we talked about this a few chapters back. So we have our endocrine function and we have an exocrine function. We have to remember that the endocrine is responsible for my insulin. My exocrine function is responsible for the breakdown of starches, proteins, and fats. Okay? Now, enzymes that are secreted become activated once they enter the small intestine. Now, whenever these enzymes are activated early, whereas they're activated in the pancreas rather than in the lumen, we see an inflammatory process known as pancreatitis. Now, pancreatic necrosis is enzymatic fat necrosis of those endocrine and exocrine cells, and that's caused by the enzyme lipase. Okay. If you look over on page 1219, figure 59-2, the process of autodigestion and acute pancreatitis, if you do want to look over that, if you're more of a visual reader. Necrosis of blood vessels results in bleeding, ranging from minor bleeding to massive bleeding. Another pancreatic enzyme causes the release of vasoactive peptides, and these substances contribute to vasodilation and increased vascular permeability. So the majority of deaths that we see in patients with acute pancreatitis, it's actually from shock that is irreversible. Now, the inflammatory stage, that happens whenever leukocytes start to cluster, and they cluster around those necrotic areas of the pancreas. Now, we have to watch out for complications of acute pancreatitis, especially for those geriatric patients. We can see atelectasis and pneumonia. Multisystem organ failure can occur from necrotizing hemorrhagic pancreatitis, or NHP. ARDS, acute respiratory distress syndrome, can also occur. Now, it's important to remember that ARDS is a complication of acute pancreatitis, okay? Necrotic tissue and enzymes, they enter the bloodstream, and when this happens, our patient is also at risk for disseminated intravascular coagulation because of the altered coagulation of all of the necrotic tissue and enzymes entering the bloodstream. Etiology and genetic risk, it's not known. The most common cause is biliary tract disease. Other causative factors can be pancreatic obstruction, any type of metabolic disturbance, trauma, penetrating ulcers, any type of drug toxicity, gallstones, or abdominal surgery. Now, pancreatic attacks typically happen when alcohol consumption is high, especially in men. Women are typically affected after cholelithiasis and biliary tract problems. Women are also most at risk for pancreatitis within several months after having children or a child. As far as our assessment, the patient's going to report severe and constant abdominal pain. We want to know if this abdominal pain is occurring when they're drinking alcohol or if it's occurring when they're eating a high-fat meal. Okay. We also want to know about family and personal history of any type of pancreatitis alcoholism, biliary tract disease, or any personal history of trauma. Now, pancreatitis, other medical problems that can cause pancreatitis are renal failure, peptic ulcer disease, hyperlipidemia, hyperparathyroidism. We also want to know about any recent viral infections. Now, sometimes the patient will be diagnosed after they present with abdominal pain in the mid-epigastric area or the left upper quadrant. Okay, the pain's typically of sudden onset, radiates to back, left flank, or left shoulder. The pain is described as intense, and it feels like it's going through their body, referred to as boring. Pain is typically worsened when the patient is lying in a supine position, so the fetal position or sitting upright, bent forward, typically helps these patients with their pain. Whenever we are performing an assessment, we want to inspect for any jaundice, a gray-blue discoloration of the abdomen, or a gray-blue discoloration of the flanks. We want to make sure that we're listening to the bowel sounds as well as assessing for any abdominal tenderness. If you'll see the table 59.4 on page 1221, it tells us that the causes of certain laboratory tests that are specific for acute pancreatitis. So we can see an increase in amylase levels. Lipase also helps to determine the presence of pancreatitis. Now, lipase levels, they can rise a little bit later than amylase, but they are going to stay elevated for about 2 weeks. White blood cells, glucose levels, those can be elevated, as well as erythrocyte sedimentation rate, or ESR. The patient can suffer from thrombocytopenia. An abdominal ultrasound is the best test for patients, but it's not helpful in viewing the pancreas. So a contrast-enhanced computed tomography, or CT, provides a more reliable image. Now, interventions are aimed at decreasing inflammation and to try and prevent and treat any complications that do occur. So, abdominal pain is a very common symptom of pancreatitis, so we want to focus on helping to relieve that pain as well, okay, controlling that pain. Now, pancreatitis does require hydration with IV fluids. A lot of the times we want to rest the pancreas, so we'll withhold foods and fluid. The patient will be NPO for the first few days during that acute period. Okay, mild pancreatitis typically does subside in 2 to 3 days. Histamine receptor antagonists and proton pump inhibitors can be given. With our patient that's NPO, or if they have an NG tube, we want to make sure that we're providing frequent oral care or oral hygiene care. When these patients are able to tolerate food, small, frequent meals, high protein and low fat, should be provided, and the patient should probably stick to a bland diet. Any stimulants such as caffeine, like tea, coffee, cola, chocolate, and alcohol should be avoided, okay? In the next segment, I'll pick up with chronic pancreatitis.